My name is Dr. Tushar Mehta. I'm from Canada, and I did my residency there in family medicine. I've also practiced addictions medicine, and I've mostly practiced emergency medicine, or what you call A&E in some countries. I have an interest in international health, and I do work in India and a few other places. And on top of that, I have a strong interest in plant-based diet and health. So when I say plant-based diet and health, you can also say vegan diet and health. And I'm here on behalf of Hina Modi and plantshift.com. So we're going to talk about the medical evidence for plant diet and health. Okay, if you look on the internet, you're going to find hundreds of websites, all with different opinions about different kinds of diets. You're going to have the variations on vegetarian diets. You can have paleo diets recommending meat, blood type diet, and all kinds of things. But how do you decide what is most healthy? It turns out that there are lots of medical studies and nutritional studies done on all kinds of dietary factors. So what I want to reference are the actual studies that are done showing the medical evidence of plant diet and health. And we're going to talk about what constitutes a good study. So good studies have various characteristics that we should know about. So many of them are very large studies. If you're doing a study, what you're basically doing is comparing different groups of people. For example, if there's a drug, you're comparing people who are taking a drug versus taking a placebo, or maybe one type of drug versus a placebo versus another type of medication. And you can compare what happens to these people as they take these medications. Now let's say if you're doing that kind of a study, you want to make sure that, first of all, you have lots of people in the study. If you're comparing 10 people in each group, then you may not get the statistical evidence because random things can happen to each person in a different group, and you're not going to know really statistically what's going to be beneficial, which medication will be beneficial. You want to have hopefully thousands of people in each group, following them for a long time. And that's the second factor. You want to make sure that if you're comparing people who have one type of diet or one kind of type of medication, you want to make sure you're comparing them for the duration of time that it would take to see if it will protect you from a disease that you might get. Okay, so in many cases, you want to follow them for many years to see if they develop heart attacks, diabetes, cancers, and those kinds of things. So it should be a big study with lots of people and followed for a long time. So those are characteristics of good studies. The other characteristics that you would see are, for example, you want to make sure that people in each group are similar. If you have a bunch of people taking a medication and other people not taking a medication, they're taking a placebo, let's say. But let's say in one group there's a bunch of smokers, in the other group there are non-smokers. You're not comparing equal groups, so you have to control for those factors. So factors such as socioeconomic status, other dietary characteristics, exercise, smoking, alcohol intake, and those factors. So good studies will take those kind of things into account as well. Another very important characteristic of studies that talk about nutrition or other things is that the studies should be done on humans themselves. Okay, when we do studies in a test tube and we say that, oh, this might be bad for your thyroid or this may have some other bad effect, we don't know that the information that's done in a petri dish or a test tube is actually going to translate into human beings. So when we do medication studies, ultimately there's the final phase, which are human trials. We actually try the medication in human beings, a large number of human beings, for the relevant amount of time, and see if it actually works, because that which works in the test tube may not translate to human beings. And the same thing goes for animal studies. Those medications that work or don't work, or are safe or not safe in animals, may be unsafe or safe or work differently in humans. So we always have to ultimately test things out in human beings and see what it is. Okay, see what the results are. All right. So that's a very important characteristic. And the final thing I'm going to mention is that when we look at studies that are dietary or medication or otherwise, we want to see that the results are clinical results. Okay, clinically relevant results. So if something just changes a blood test, let's say something makes your cholesterol go up or down a little bit, that may be important, but what's really important is whether you get a heart attack, whether you get a stroke, whether a person survives. Did they die? Okay, did they die, have a heart attack, or die of some other cause, some other side effect of a medication or a diet or whatever it might be. So we want to know about death, we want to know about disease. So good studies are going to look at human beings for a relevant amount of time and large numbers and see if they get certain diseases or just actually measure their survival as well. They're going to check for diseases and for survival as well. And that's what the kind of studies are that we're really looking at and that we want to know. So those are the main ones that I'm going to include in the different talks I'm going to give for various topics regarding plant-based diet and health. Okay. There are some exceptions. Sometimes a small number of people can achieve statistical significance if you have very powerful results from some kind of an intervention, whether it's a medication, a surgery, or in this case, diet. Okay, and when we look at randomized trials where you take a group of people and you put them on a certain medication and you put the other group on a certain medication, if there are dramatic results for that, then sometimes a small group of people can still give you valid information. And there are some dietary studies where they look at people and they actually tell them to go on a plant-based diet and the other group to not go on a plant-based diet, and they see what happens as they follow the people further on. So there are a few studies with smaller numbers with statistical significance because the outcomes are so different between the two that you can actually measure it even in a smaller group of people. So those are intervention-based studies, as opposed to other studies which follow people, but they've just had a diet of their own choosing, and you watch them as they go forward, but again, controlling for the different factors that we talked about, such as smoking, gender, age, socioeconomic status, and so forth. Okay, so those are the type of characteristics we look at for a good study that is reliable, that you can get information from. And when we see anything on the internet, whether it's my talk right now or the talks that I'm going to give, or other things that people say on the internet or an article, it's really important to be able to have the references available, be able to look at them and see how reliable the studies are. Now, why is this relevant? Okay, so why is it relevant for me to be interested in plant-based diet and go through these studies? And the reason is that as a physician, I deal with people who have diabetes, heart disease, strokes, and obesity and hypertension day in and day out. And these things have a dramatic effect on people's lives, cutting their lives short or decreasing the quality of their life because they've got this heart disease, diabetes, and other things that maybe they're living longer because of the medications and treatments that we have, but the quality of life is very low. Their health is significantly impacted. But oftentimes they simply die of a heart attack or a stroke or something bad that could have been prevented. There's also some evidence that plant-based diet can prevent certain types of cancer, or at least certain type of plant foods are good at preventing certain types of cancer. So it may not make you bulletproof and completely cancer-proof, but if you can reduce a percentage of cancers, relevant cancers that affect people, then that's also really important. So those are some of the main reasons why this is an important topic, and I've spent so much time learning about it, providing the references, and talking to you about it on these videos. So the references for every single video that I have are going to be downloadable from the description box, where you can click and download the entire set of references and then just scroll down to the relevant references. If it's a video on diabetes or cancer or something like that, scroll down to the relevant section and take a look at the references that I'm speaking about. In my videos, I'll generally discuss one reference, but it's going to take too long to discuss 10 references and you'll be bored out of your mind. So I'll discuss one, and then you can go into the reference list and look at more references that are talking about the same topic. And it's important not just to have one reference, but to have multiple references that discuss a topic, because then you're seeing that different studies are being done in different places by different people, and they're getting similar results that are reinforcing each other. Okay, so that's another good thing to look at.